Thanks for joining us to learn more about music therapy at VCU Health. In this video, you're going to see examples of what music therapy specifically looks like at VCU. So you're going to hear from Brooke Cable and talking about pediatric music therapy. Then you're going to hear from Melissa Owens about adult music therapy. And then last, I'm going to finish up and tell you about memory making music therapy. Thanks for being here.
Hi, my name is Brooke Cable, and I'm one of the board-certified music therapists here at VCU Health. Now, as you might know, music therapy can serve any unit of the hospital, but I want to talk to you today specifically about music therapy with pediatric patients. So on the screen here, I have goal areas that we often address with pediatric patients, but really quickly, I want to talk about where we might serve pediatric patients, mostly in the hospital. We get most of our referrals from Child Life. We're really lucky to be able to work with them. But we go to, of course, Main 7. We often see pediatric patients in bone marrow transplant, burn units, the EMU, and we also go over to the Children's Hospital outpatient clinics, hematology, oncology, and infusion and dialysis to work with patients there. So the goal areas with pediatric patients, there are a lot, but I want to hit on what I think are the most important ones. So when we work with pediatric patients, one of our primary goals is always to help normalize their environment. So as a kid, we can only imagine how overwhelming and scary and new the hospital environment must be. So music works really well to help normalize that environment, bring in something familiar, bring in something they trust, bring in something that might be able to calm them, just make them feel more at ease with being in this environment. We work really hard to build trust and rapport with our pediatric patients. It's so important for patients to feel comfortable with their care providers, and they see so many people every day, all day, in and out of their rooms, that we really value that relationship, that predictable schedule that we're able to build with them to help them feel more at ease in general while they're here. We work really hard to support patients' autonomy. So especially with kids, a lot of them are already seeking control in different parts of their lives, and especially in the hospital, almost all of that's gone. So that can look like, what do you want to do today? Or it can be something as small as, do you want to play the blue egg shaker or the red egg shaker? Giving them choices and supporting their decision making is vital in making sure that session is patient focused, making sure they feel successful, making it something that they can control while they're here. We also offer lots of opportunities for self-expression. Again, that's not something they often can do while in the hospital, whether that's writing a song, playing an instrument, singing, recording a song. We always meet the patients where they're at. We never force them to do anything. They're allowed to decline us whenever they want. It's completely up to the patient how they want to express themselves in the moment. Some of them are very expressive. Some of them like to be led more by us, but it's always patient-focused and individualized. Especially for the little ones, we offer opportunities to engage in age-appropriate developmental musical play. So a kid needs to be a kid even while they're in the hospital, and if that's practicing their ABCs, practicing using both hands while playing instruments, we really encourage those developmental milestones to be hit even while they're here, especially for the patients who are admitted for lengthy periods of time. We work really hard to make sure they stay on top of their speech goals, physical therapy goals, and while we're not obviously speech or physical therapists, we work in conjunction with them a lot to make sure that they're hitting those developmental milestones while they're here and supporting them in usually what's a fun way for them. Family support. We try to involve the families as much as possible. A lot of parents, when their child's in the hospital, say, I wish I could do something, I wish I could make them happy. And providing music therapy is a way for them all just to take a moment to sit back and enjoy engaging in something positive together. Whether that's playing instruments together, singing songs together, it allows that family bond and that family cohesion to still happen while in the hospital. We work really hard to reduce stress and anxiety. We get a lot of referrals because the patient is just very anxious and needs help sleeping, needs help regulating their day. And having predictable music therapy sessions often really help to bring their anxiety levels down. That leads really well into procedural support. So we can do this in a variety of ways, whether it's attending a wound care or dressing change. A lot of those seemingly small things for adults are very anxiety inducing for kids a lot of the time. Things like accessing your port or de-accessing a port can be very scary. So giving them opportunities to refocus their attention from the scary thing that's happening onto the music has been really great for getting those procedures done quickly, efficiently, and returning them back to their baseline quickly afterwards. That's not to say that they're not going to feel the prick or they're not going to feel the blood pressure cuff, but it helps the nursing staff and the other staff members in the room when they can de-escalate quickly and return quickly to their baseline. Overall, we also help to facilitate a positive change in mood. There are some days you're just not feeling well, they're not engaging in their care, and music therapy can be really successful in just giving them a little boost of mood. Now, not all of our sessions are just singing songs and playing instruments and writing music and really active things. There are also patients who really aren't feeling well while they're here. And the number one goal in a music therapy session is to meet them where they're at and don't force them to do anything they don't want to do. For some patients, it's us coming in and providing relaxing music, something that they don't have to be actively engaged in, something they don't have to be talking during. They can just close their eyes and we can help them relax. No two sessions look alike. I want to share with you here some pictures. This is one patient who was here for a while who did not speak any English, neither did his family. And I'm sure you've heard the phrase that music is a universal language, and that was so true with this patient. With every other medical team encounter he had to use a MARTI, he had to use an in-person translator, but within his music therapy sessions, none of that was needed. We just used solely the music to communicate. I didn't know very much of his language at all, but we worked together to communicate through song. So he shared with me a ton of his favorite songs that he learned growing up, taught me how to sing them. His dad was engaged in each session. And those 30 minutes in his day were those moments where he didn't have to worry about how he was feeling, didn't have to worry about what he had next on his list to do today. He could just sing the songs he grew up singing and feel a moment of relaxation. This is another patient with a lengthy admission who doesn't speak English. We learn songs together, whether that's learning some in English or learning some in his language. We do a lot of improvisation. We both have instruments and we use the music to communicate and play together. We also work to address developmental milestones, making sure that he was hitting those milestones at the rate he was expected to, if not in the hospital. With this patient, but also with many other pediatric patients, music therapy sessions are a great opportunity for us to support the family by giving parents a break. I'm sure we've all seen parents that never want to leave the bedside, want to make sure their kid is attended to at all times. Music therapy sessions are a great opportunity for parents to either engage in the session as much as they want or take a step back and take a breather for themselves. Now, music therapy sessions, like I said, are not always singing, dancing, playing. If you walk down the hallway, you might see our cartload of instruments, our guitar in our back, but everything we do is very intentional. We have thought about goals, objectives, how we're going to get there, and we're always looking for measurable outcomes. This was another patient with a lengthy admission whose main goals were to reduce stress and anxiety. She came to the hospital in a lot of pain, a lot of anxiety surrounding all the care providers in her room all the time. And at first, I supported her by letting her say no when she didn't want music therapy. But I always offered her that choice. And after a while, it became her favorite thing. I'd see her as often as I could during the week and offered opportunities for her to share her favorite music with me, sing her favorite songs, and engage her family as well. We're also really lucky to work with a program called the Ukulele Kids Club. So these are just some of our recipients of ukuleles donated from the Ukuleles Kids Club. And the goal is to provide them with something to work towards, provide them with something that they can keep and take away that's positive from their experience in the hospital. So a lot of these patients wanted to actually learn how to play. And at the end of their admission, we surprised them with their own ukulele to take home. This is just another way that we work to make the environment as supportive and as positive as possible for pediatric patients, to make them as comfortable as possible. If you have a patient you think might benefit from music therapy, let us know. Give us a call, shoot us an email. Pediatric or adult, we do serve all areas of the hospital. If you're unsure whether or not the patient would be appropriate for music therapy, we can go ahead and meet the patient, make an assessment, and then determine appropriateness from there. Don't hesitate to reach out. We look forward to hearing from you. Thanks so much for your time.
I think most people are aware when they hear about music therapy that children are the recipient of music therapy. In fact, I think a lot of times that's what people assume is the target population for music therapy, but that really couldn't be further from the truth. We actually work with a great deal of adults here at VCU Health. It's a large part of what we do. We do things differently than we might do with pediatric patients, but many of the goals that we address are similar to those that we might address with a patient of any age. Adults experience pain, stress, anxiety. We have adults that have received news, perhaps of a diagnosis that they didn't expect. We have adults at end of life. We have adults who are experiencing a mental health crisis. And all of those types of people that we encounter can benefit in one way or another to music therapy if music is something that is important to them and that they can relate to. So that can look like a variety of things. We can address our goals with patients through songwriting. Songwriting is a wonderful way to express oneself. It's sometimes easier to express ourselves writing something down, or even choosing a song and saying, you know, the lyrics of this song really tell you a lot a bit about what I've gone through in my own life. People aren't always ready to share intimate details about their lives and what they've been through, but often through the act of songwriting or even lyric analysis or music listing, we're able to help patients work through some challenges that they have related to being in the hospital, or even things that are secondary to being in the hospital. Some of our patients have difficult relationships with family. Some of our patients are lonely. Some don't have family members at all. They may just have a strained relationship, or perhaps their family lives out of the area. So many times our patients enjoy not only having the presence of another person in the room, but are able to do something that perhaps they might not do outside of a hospital. Maybe they have never thought about writing a song. Maybe they have never tried to use music to assist with relaxation. Maybe they have never played an instrument. Maybe they have not banged on a drum to help express frustration. These are all things that we can do as a part of the music therapy that we do. Just as with pediatric patients, our adult patients are referred, and as I said earlier, it may be for pain, it may be for anxiety, it may be for stress, it may be for a myriad of other reasons, but our approach is the same with every patient, whether they are 18 years old, whether they are a 100-year-old adult, whether they are end of life, whether they're just in the hospital for surgery. No matter what they're here for and no matter what their age, we try to meet their needs musically based on what their musical interests are. So I'd like to share a story of a particular adult patient that I worked with several years ago. It was a gentleman who was referred because he was having a great deal of difficulty sleeping, and because of this, he was not participating in his physical therapy, which was a very important part of his recovery. he was encouraged to walk several laps around the unit several times a day, and he just simply was unable to do it. He was unable to get out of bed simply because he had such a difficult time sleeping. So we were called to perhaps try to help work this patient through relaxation and breathing through music. So I went in and I met the patient, and he was a little bit hesitant when he saw me walk in with a guitar. Guitar music was not something that he was familiar with. It was not something that was his preference. But he reluctantly allowed me to share a little bit about what music therapy is and how it might be able to help him. And I think he was so desperate at that point to get some sort of relief and to be able to perhaps get some sleep, get the needed rest that was so important to him, that he allowed me to take my guitar out of the case and to just play something instrumental for him. And what he didn't realize is that he had never heard a guitar separate from a band or a large group of instruments. He'd never heard a guitar just by itself. And he found that he really enjoyed what a guitar sounded like, even though that's not something he would have ever sought out or expected. One of the things that was really wonderful about working with this gentleman is that he was able to monitor his vital signs while I was playing the guitar rather, and while he was listening. And I was able to say to him, "Do you see how your heart rate has decreased? You were so anxious when I walked in, but your heart rate has decreased with the use of music and relaxation. I've noticed that your breath has slowed down. Your breathing is less labored." And he, through that, began to come around to the idea of music therapy. So I ended up working with him regularly several times a week. Eventually, he was able to learn to help himself using music that we recorded to help himself fall asleep at night. And he eventually was able to get off of the medication for his insomnia and get a night's sleep and get up the next morning and participate in his care, in his physical therapy and the other things that he needed to do. So we're often not just there to provide a break to allow a patient to listen to some music, although sometimes having someone bedside playing music can be very, very meaningful for a patient. It can allow them to reminisce. It can bring about maybe positive associations in their lives. But we also have to be mindful of the fact that sometimes music reminds us of a time in our life when maybe we weren't happy, or maybe we were going through a breakup, or maybe a song was on the radio when we first heard that we had a diagnosis of cancer. So it's important to us that we're responsible with the kind of music that we use and that we don't prescribe any one type of music for a patient. But it's very important that people understand that music therapy is not only for children. It's for everyone. It is for every age. Our adults that have dementia are still able to sing because music is a whole brain experience. And if they may have the inability to recognize anyone in their life or any objects in front of them, they're still able to recognize a song and even able to sing and maybe identify a time in their life that is associated with that song. So it's important for me to let everyone who wants to know more about music therapy to understand that music therapy, as I said, is for everyone. It's not just for children. It can be as meaningful and sometimes even more meaningful for adults because they've had a lifetime of musical experiences and associations with music. So I hope this has helped understand a little bit about how music therapy is used not only with children, but also with adults. For those of you who are staff members and may have an adult and you're not quite sure if music therapy might be right for them, we are more than happy to meet your patient, to understand a little bit about what they're going through, and to perhaps create a treatment plan for that person if they are appropriate for music therapy services.
Hi, I'm Molly Luck, and I'm one of the board certified music therapists at VCU Health. I'm going to be discussing music therapy and memory making, specifically one of our projects called Heartbeat Songs. And we call it Heartbeat Songs because it is literally a song that is using a patient's heartbeat as the rhythm. So, most commonly, we use it as a form of memory making that can help us honor, celebrate, and remember our loved ones through music. And again, it's a song created with a patient's heartbeat as the rhythm for a song that's significant or meaningful to a patient or a family. So, as far as how a heartbeat recording works, it's a little bit different every time. So, with the introduction of the idea to the patient or the family, sometimes this is done by us music therapists, and sometimes it's a patient that we've been working with for a extended period of time, and sometimes we know that it is an end of life situation, and sometimes that's not something we know going into working with a patient. But we introduce the idea as a form of memory making to the patient or to the family and make sure we receive consent for this project. So we make a heartbeat recording from a stethoscope that has a recording capability that's pretty high quality. And then we make sure we have a song in mind from the patient or the family. And it might be an existing song, or it might be a song that a patient has written, or it's one that we write with the patient in mind. And then we have the creation of the heartbeat song. So we do not claim to be audio engineers, but we do our best with some different audio programs where we merge the patient's heartbeat along with us recording vocals, guitar, piano, different things like that to create the end product of the song. So I think the best way to help you understand what a heartbeat song is to show you one. So this specific heartbeat song, the patient's family wanted Imagine by John Lennon. So I'll let you hear just a little bit of the song.
Imagine there's no heaven. It's easy if you try. No hell below us, above us only sky. Imagine all the people living for today. Imagine there's no.
We're going to stop it there. But hopefully you get the idea there that we have the heartbeat recording that we put on a loop so it lasts throughout the whole song. You could always hear that heartbeat. And then we record on top of it the preferred song from the patient or their family or their loved ones. So this next example, this one in particular, I really like because of the story that kind of goes with this heartbeat song. So this was a patient that was a long-term admission, and it was not expected to be an end-of-life situation, but that's what came to be. And this patient was a lifelong musician, lover of music. And during their stay in the hospital, music therapy was a significant part of their admission. And so when we did find out it was end of life, we spoke with the patient's sister, and they thought this was the perfect way to pay tribute to the patient and the perfect way to remember them. And it came to be that it was around the holiday season and that was really significant to the family. And we were able to make the heartbeat recording and send it to them by CD. And they were able to surprise the family at Christmas with this heartbeat recording, as it was their first Christmas without this patient, part of their family. So it was especially significant, and it was something that we hoped was a special gift to the family. So this one is My Girl.
I've got sunshine on a cloudy day. When it's cold outside, I've got the month of May. Well, I guess you'd say, what can make me feel this way? My girl, my girl, my girl, talking about my girl, my girl.
So that was just a little sample of the Heartbeat song with My Girl. All right. So last I wanted to talk about this gal right here. We don't always use heartbeat songs just as an end of life memory making situation. Sometimes we have patients who enjoy songwriting themselves, and sometimes it might not start as songwriting, but patients sometimes have long-term admissions, or they have admissions that are just particularly taxing, and something like a heartbeat song can help them create a way to express themselves during that long admission or during that difficult time. And we have the patient's heartbeat recorded, and then they can compose their own song over it. They might talk about the hospital stay, they might talk about what they're experiencing, or just different ways to express themselves. But it's a song that's so unique because it has their particular heartbeat as the rhythm for the song. So this picture here shows a patient who really enjoyed writing and was a talented poet. And so they put the heartbeat recording that they had over one of their writings, and it was just something really powerful and something that only could come from them. All right, so I hope that helped you get a better understanding of heartbeat songs and how we utilize them at VCU Health. Thanks so much for coming to learn more about music therapy at VCU Health. We hope this increased your understanding and helped you understand a little bit better about who we are and what we do at the hospital. But if you have any questions, please feel free to contact us by phone or by email.